When can a working pregnant woman stop work and stay at home to take care of her pregnancy? And after she has put to bed, how long can she also stay at home to take care of herself and the baby? We have two types. We have the maternità and we also have the maternità anticipata. So in this video, we'll be discussing the two. So let us start with the maternità, which is the normal one, which is you are supposed to stay at home for 5 months. That is what the law permits, 5 months. And that 5 months could be 2 months before the date of delivery plus 3 months after you put to birth, making 5 months. You can also alternate it. You can also make it 1 month before the date you're supposed to put to birth. That is, you can decide to work to up to about 8 months. It depends on the type of job that you are doing. If the job is not strenuous, and you can decide to work to about 8 months, so you go to your maternità a month before the date you are putting to bed, then 4 months after you put to bed. Or you can still alternatively decide to just work until 9 months. The immediately you put to bed, you can now stay for five months. So that's how it works. You have 5 months. You can decide to do it 2 months before, then 3 months after, or 1 month before, then 4 months after. Or you can just decide to just work till 9 months. Then you can now stay for stretch 5 months at home. That's for the maternità, the normal one. So how much will they be paying me for this maternità leave? They'll be paying you 80% of your salary. So if your salary used to be 1,000 euros, they will start paying you 800 euros for that particular period every month. So it is 80% of your salary. The other one is called maternità anticipata, which is the maternity leave you can go before the recognized one by law. You know, you have to work to about 7 months normally, but with this type of maternità anticipata, you can decide to go for this maternity leave even before that 7 months, and it is based on health issue. Maybe there are some women that work in a fabric where they do chemical. That chemical could be harmful to your health or to the health of your baby in the womb. So because of that, you might not be able to continue that type of work. Or you could be a teacher. You cannot just stand for 8 hours and be teaching every day. So you might also have health issue on you on the pregnancy. So depending on the type of work you are doing, are you a trailer driver? Are you working in a fabric where you need to lift something? And because of that, now you are feeling somehow, you are feeling waist pain, you are feeling belly pain, you are feeling all this pain. So if you know that your health is not okay, or the work you are doing is strenuous, it is heavy, in that case you can ask for maternità anticipata. So how will you go about it? Although it depends on the sector that you are working. There are some sector, if you are working there, this is where you will go. There are some also sector, if you are working here, this is where you will go. So the best option, what I would just say is that if you know that the work you are doing is difficult and is not good for your pregnancy and your health, so even if you are working in agriculture, you are working domestic work, you are working in normal fabrica, or whether you don't even have fixed contract, yes, you can see enjoy this maternità anticipata. Just go and meet your doctor. Your doctor will put you through the procedure. There are some tests you have to go and do. There are some control you have to go. You will even go and meet a gynecologist to do his own control. Then they will give you the certificate and every other thing. So just go and meet your doctor. They can put you through. So if you go and they reject the request, that does not mean you should give up. So the next 2-3 weeks, you can still go, still be complaining that same complaint to them. You are feeling headache, you are feeling this. So if you just realize that they've rejected your request, it is better for you to take care of yourself than for you to continue that type of job. So you can go back again to your doctor, complain the same complaint until they accept that particular request. So you can go. So how much will they be paying you if they eventually accept your maternità anticipata? They will also be paying you 80% of your normal salary. So if your salary used to be 1k, they'll be paying you 800. So they'll still be paying you. Now this one does not affect your normal 5 months for the maternità. No. So this one is just the anticipo. The one, because of health issue, you can stay at home. So when that normal time comes, 7 months or 8 months, you can go to your normal maternità leave. So this one does not affect. So there are two different things. So this is it. Thank you and God bless you.